Karen, you wanted me to put this up, should I? run
Yeah,
the Zoom?
and we are now live. This is Senate Health and Welfare having nutritious treats, and we're back live with Jack Harvey, our lead counsel, and we're talking about two bills that potentially we could vote on today. One is breast imaging, so H622, let's start with that. And I don't know if we got the response regarding tissue biopsy, needle aspiration.
Yes.
Okay, so it's,
You want me to? Sorry, I sent it.
Do you want her to talk while I pull this up?
yeah. Did you get a response, an answer?
Yeah.
Oh,
Jill Sundhoff Garen for the Medical
could
Society.
you, yeah, good, thank you.
So I talked to Hannah Perry yesterday. She is the division chair of breast imaging at UVMMC. And she gave a detailed response to how they respond. And it starts with a lay letter that the FDA requires that everyone gets when they get their breast imaging done. And then that includes the callback. And then that's when they start talking about financial implications. And then that information also goes in your my chart. I sent the response that Hannah sent to Ruth, you and
Oh, right.
Kiki, in an email. So if you want me to, if you want me to read it.
Kiki has it, I think. Do you have that email that?
I do, yes.
Okay, let's put that one up, please. I did see it.
Okay.
I didn't digest it.
I actually did not see a challenge, sorry.
Yeah,
I know you told me you were gonna send me something, but
yes.
Almost ready for you.
So while we're waiting, Senator Goulart, do you have a recommendation for a nominated person?
I do, I spoke with Judith Scott and I would like to nominate her for the Board of Medical Practice. Thank you, sorry.
And just a little bit about who she is. Do you have that?
Judith is a field director with
If you have any other questions.
Vermont Refugee Resettlement Program, and she's very interested in serving and is excited about the opportunity.
Terrific. Okay, so we have, are you moving to nominate her?
Yes, I'm making a motion. Okay.
Do you have a medical background?
If you're gonna ask me questions, I will call her back,
Oh,
because I didn't do a deep
Okay.
dive.
She offers.
But I can do a deep dive if you all would like me to.
I think what we're hearing is that she offers diversity on the medical practice board for refugees who might need healthcare, so it fits in with our health equity initiatives that we have. So, yeah, and there are other MDs and practitioners on the board. This is the public member.
Yeah, but I'm happy to, she was very amenable, we had a nice chat, and I'm happy to call her back to get more information, that's not a problem. So maybe we should wait till next Friday.
We can do that. You wanna wait? Matt, go ahead.
Yeah, let's wait.
Okay.
Back to the other thing. Thank you, Jill,
Yes.
for providing that information. If Kiki could post it, I think it's really useful to show what the process is, to make sure that patients understand that there could be something else that's not covered with imaging. Good, thank you.
Yeah,
I know you guys
So is it on
ran
the
around trying to
webpage?
get that, I appreciate it.
Yeah, no.
Okay, so it's on our webpage. We can look at it. But
I'm ready
if
when
you're
you-
satisfied, Senator, well,
Yeah,
I was okay with it.
All right, good morning, Jen Harvey from the Office of Legislative Counsel. So putting up the language of H621. This is the bill on health insurance coverage for diagnostic breast imaging. And it is also largely around cost sharing. Because as I understand it, the plans generally cover the imaging, but not always without cost sharing. So this is, again, insurance coverage for not only screening by mammography, but also for other medically necessary breast imaging services upon recommendation of a healthcare provider as needed to detect the presence of breast cancer and other abnormalities of the breast or breast tissue. It also requires, in addition to coverage for screening by ultrasound, would also include other appropriate imaging service for a patient whose results are inconclusive or who has dense breast tissue or both as a result of the results of their screening mammogram. Benefits provided must cover the full cost of the mammography, ultrasound, and under the bill, other breast imaging services without any cost sharing, except to the extent that the coverage would disqualify a high deductible plan from eligibility for a health savings account. We talked about that last week or earlier this week, about the IRS determination of what's preventive services eligible for first dollar coverage. The only other change is adding a definition of other breast imaging services, which is diagnostic mammography, ultrasound, and magnetic resonance imaging, MRI services that enable a healthcare provider to detect the presence or absence of breast cancer and other abnormalities affecting the breast or breast tissue. The bill would take effect on January 1st of 2026 as plans roll out over the course of the year, but not later than January 1st, 2027. This allows the insurers to build the no cost sharing into the plan design for 2026 plans.
Okay. Questions?
Yeah, hopefully, if I can, I'm just like, devil's advocate for a second. So I'm just curious, and this is for more committee discussion than anything else. So I understand the premise of the bill and the benefit and such, but my curiosity is, well, two. One word, if we don't cost sharing, cost then shifts towards the insurer or the medical facility. And we're in an era of rapidly increasing medical care costs, which we saw most recently evidenced in education cost increases for the past year and they're affecting property taxes. But my real question is, why are we singling out this single procedure as opposed to the tens of thousands of other procedures which sure exercise on a daily basis?
So I think we heard that breast cancer is second highest in cause of
Up
death.
to the first,
Yeah.
didn't know that.
So that's one reason, and then we're just following coverage that has happened in public medical environments like Medicaid.
Okay, why not the number two, lung cancer?
Well, we're trying to do that with
Oh,
this AD.
that's my point, we're chiseling down, we're chiseling away at costs which are paid or borne by the patient, which I understand why we're doing it, but it shifts costs to the medical community, the medical facilities, and it's a slippery slope. I just, that's my question.
We also get matching dollars for all of this, but
Well, one, I think, as Senator Lyons said, the fact that this is the number one killer of women in our state. We have a high breast cancer rate compared to other
It's the
states.
number one cancer.
The number one cancer. And then two, we also got testimony that the fiscal impact of this is almost negligible. It's not much at all. This is a narrow slice of the pie that this bill would impact. And the largest insurance company that this would impact came in and testified and said that this would have almost no effect on their rates. Because they cover most of this except for the high deductible plans, which are excluded. The ERISA plans are excluded, which are the self-insured plans, which a huge number of Vermonters already have. And then the health insurance plan that the largest number of Vermonters have, which is Medicaid, already covers this without cost sharing. So this is a very, very small slice of the pie, and the fiscal impact is very negligible. And we got testimony to that.
I recognize that, and I do recognize it affects, Medicare is one issue, but commercial insurance is completely different issue. And again, it's death by 1,000 cuts with, just giving you a perspective, it's coming through constituents is, how are we dealing with the inflating costs of medical care?
This is helping the cost of medical care for your constituents who are on private insurance. This will reduce the cost of their care because they will not have a cost share for this. And the insurance companies have come in and testified, saying that this will have no effect on their rates because it's such a small amount. If you want to talk to your constituents about how you're saving money for them, pass this bill. Because this is how you're saving
I'm
money
just
for
having a
them.
conversation.
I'm having a conversation too, Dave.
Let me add a third slice to this, and that is that this represents a prevention step. And so if you have early diagnosis, then you prevent the extenuating circumstances that people have when breast cancer becomes metastasizes or, extends to lymph nodes and other areas where surgery might be required. So treatment can be a lower level with early diagnosis. So in many ways, it's an important medical prevention piece that reduces costs overall. So, and everything else that Senator Hardy has added is accurate based on our testimony. So I don't know what more we can say.
I'm
about
just
that.
asking you
Yeah.
a few questions. I
Yeah,
appreciate the
good.
opportunity.
Yeah, good. Okay. Well, it's important because, what we've heard, let's flip over to compacts. When we talked about compacts, we know how excited we were about them. And then all of a sudden we see the effect on OPR and the money that's needed at Secretary of State to sustain those programs. We want to make sure that the benefits that we're getting are.
Yeah, and I mean, I just personally, I think I think using this forum to potentially vilify one group or one party as like the big spender is problematic. I'm
I'm
gonna say
not
that.
sure.
Okay.
No,
Is any, you don't?
No.
Okay, cause I just keep hearing the same, it seems like it's a repetition of you all are increasing our healthcare costs, you're. And it's a narrative that I keep hearing, and I'm just saying. It's first of all, it's inaccurate, because we just debunked it, second of all, it's not cool, it's not fair.
Well, if I may, I'm sure, the truth is, that our state's healthcare costs are escalating,
Yes,
so we need to figure out why that is.
Right.
And we need to address it.
So one,
That's all.
let's go through the litany again. 1, prescription drug costs. 2, inflation, huge. And 3, we haven't had sufficient regulation on costs, so we're doing that. S98, prescription drugs. Trying to look at what the Green Mountain Care Board can do more with respect to insurance companies, and we're looking at 766 in terms of regulating all of that administrative burden that adds costs and reduces access and affordability. So there are a lot of bills in here that we're working on. This one is critical in prevention and early diagnosis. You can paint it any way you want. You can say, oh, gee, somebody has to pay for it. Reality is somebody has to pay for the addiction that kids get when they have nicotine in their systems. Somebody has to pay for COPD. Somebody has to pay for emphysema and all of those things where we try primary prevention and it's knocked down. So I don't want to go there. I do want to go there. And we have H72 where we're looking at the continuum of care with recovery centers. We're looking at peer support that reduces in a really anyway, so there's a lot.
Good, thank you.
Yeah, they're doing work.
Appreciate the opportunity.
You guys are all doing great work and I really appreciate it. So that's a good question and I think we sort of defended it adequately.
Thank you. Sure.
Okay. Does anybody want to make a motion on this bill?
I move that we didn't make changes to it, did we, Jen? That we report favorably the House version of S. H 621, thank you. Yes, did I
That's
Yeah.
good.
Don't
That'd be
forget,
good.
yeah, there we go.
We just need to have a clerk with a piece of paper.
Got a pen. Now I've got the paper. Thank you. Okay, and today is the fifth, is that correct?
You wanna repeat what's the?
I definitely will do that, yes. This is H 621 as passed by the House.
Mhm.
H 621 as passed.
Do that.
As passed by House. And it's, the name of it is an act relating to health insurance coverage for diagnostic breast imaging. And we'll do the vote. We'll start with me. I guess I like to start with myself. And I mean, yes. Senator Hardy?
Yes.
Senator Williams?
Yes,
Senator Vice Chair Weeks?
yes.
And Chair Lyons?
Yes.
Well, so it's 5-0. Thank you.
Do we have a reporter?
I'll report it. Go for it. I'll do colorectal.
You can do the colorectal one. I can talk about my, personal experience on the floor. That'll be fun.
Yes. Me too.
Remember. Okay, so,
This is Senator Hardy on this one. Okay.
well, we don't know we don't know if we'll be reporting colorectal. We have to discuss.
Oh, this is true. Sorry, I jumped ahead. Sorry,
Yeah.
everybody. Amendment sponsor, there's no amendment sponsor. Thank you.
All right.
Okay, so let's,
Now we have H 741. This is an act relating to health insurance coverage for colorectal cancer screening. And as you may recall from our walkthroughs of this one, the main change here is to align the coverage requirements in Vermont statute with the coverage provisions in federal law, which is to make them aligned with the U.S. Preventive Services Task Force recommendations. So for an insured who is not at high risk for colorectal cancer, the examinations and laboratory tests will be covered in accordance with the most recently published recommendations established by the U.S. Preventive Services Task Force for average risk individuals. And we keep the existing language around the coverage for an insured who is at high risk, which is as examinations and tests as recommended by their treating, we've changed physician to clinician. So in existing law, as you may recall, we have language around specific to age and specific to certain types of testing at certain times. And so this takes all of that specifics out and aligns with the US PSTF recommendations, which is again what the federal law requires. So that's what the plans have been doing anyway. And this would take effect on January 1st of 2025, unlike the other one, because there is no plan design change to be made since the plans have to comply with federal law as it is. So it would take effect on January 1st, 2025, apply to plans as they roll out over the course of the year, but not later than January 1st, 2026. And that's with our standard kind of health insurance plan or benefit language, recognizing that not all plans start on June 1st.
okay. Questions?
Is it in our folder for private building?
You have
I don't think so.
741 up on our webpage.
I don't believe so. I think I just looked it up.
Yeah, I can find it in the bill section. All right, so.
We should look at it.
Have any conversation?
Let's see.
Here we go. Have we made any changes to this?
You have not,
So this is
not to date.
comparable with the last, where we're concurring with a House proposal. And I think we heard similar information regarding cost.
Okay, great. In this case, my understanding is there would be no cost differential in the, for the insurance plans because this is already what's required under federal law.
That's easy.
Oh, wow, this will be really easy to, yeah, if we pass it, it'll be easy for me to report it. We're just following federal law.
Questions?
Right, we're aligning with federal law.
We're
So
aligning with federal law.
somebody reading our
This is
statutes and
unfair.
tell what,
This is fair, she gets me.
tell what actually covers.
If she. Do I have a motion for this bill?
I move that we, report favorably H, didn't write this one time, 741.
Yeah.
And for passage, concur with the House, all of those things, do the things.
And I will second the motion. Really exact.
And then you're going to repeat the motion so it's clarity. Okay.
Second motion for the colorectal screening, cancer screening, H741, and now we'll do a vote. Starting
So it's the draft as we received from the.
as by the House.
Yeah.
And Senator Buick is a yes, Senator Hardy,
Yes.
Senator Williams.
Yes,
Vice Chair Weeks.
yes.
And Chair Lyons.
Yes,
500, thank you.
and so, I think. Unless I hear a disagreement, Senator Bullock has indicated a willingness to report the bill. So you owe your colleagues a simple bill for reporting. Good. Good, thank you. I think that's it, and I'm unfortunately, I think what we'll do, instead of trying to,
Fine, I think you had originally scheduled me only until 10:15.
yeah, so, we're gonna, we have JRS 44 scheduled at 10:15.
Thank you.
So Senator Bykowski is going to be coming in, and then Federal Attorney is already here. We're trying to sort out, well, so let's take a short break and maybe you could let Senator